Have you ever heard of someone having a prolonged death, connected to a machine with tubes and catheters to keep them alive? It's a difficult thing to think about, but here at JenCare, we believe everyone has the right to decide what kind of treatment they'll receive should they find themselves in that situation. And that is why I want to talk to you about having a living will. A living will is your declaration for how you want to be treated when you are in a near-death situation that your doctor has determined to be irreversible. You can choose to be treated naturally with a focus on comfort and pain control, or you can choose to be treated with invasive and potentially painful maneuvers that may prolong death only for a short period. This living will speaks for you, only in the case that you cannot make decisions for yourself. Your living will would save your family the anguish of having to try to make these decisions for you. Your living will would only be used if your physician strongly believes that you have a serious condition that is incurable and that death is inevitable in the near future. It doesn't apply to things your doctor believes are reversible. Here is a breakdown of some of the declarations you make in a living will. First is the decision about what would happen if your heart were to stop. You can choose to have your heart artificially pumped with chest compressions and possible electrical shock. Or you can choose to allow your body to naturally pass with a focus on keeping you pain-free and comfortable. Chest compressions are known to be quite painful and can break the bones in your ribs, your sternum, or spine. Second would be the decision on what to do if your lungs were to stop working. You can choose to be connected to a breathing machine in order to be kept artificially alive, which is referred to as intubation, or you can choose to forego the machines and allow your body to pass naturally. Many people in the final stages of their life, once getting intubated, may be kept alive artificially for long periods of time, but there is a strong risk of infection, bleeding, pain, and discomfort. Also, patients are usually kept sedated and therefore unable to communicate to loved ones. Third would be the decision on what to do if your kidneys fail. You can choose dialysis or you can choose medication. Dialysis refers to artificially connecting your body through tubes or catheters to a machine that can filter your blood from acids and toxins that may make you confused. Dialysis can be continued for long periods of time, but is associated with a risk of bleeding, infection, blood clots, and severe fatigue. The other option is to be placed on medications to make you calm and pain-free. Lastly is the decision on whether or not you would want artificial feeding tubes. A feeding tube is placed in your nose, mouth, or through your skin to your stomach, allowing nutrition to be given. Although many patients can be kept artificially alive with these tubes, they are associated with pain, risk of aspiration, fluid accumulation in the lungs, and have not been associated with improved quality of life. Remember, we are discussing only conditions your doctor believes are irreversible, and that any artificial efforts would only delay death shortly, rather than allow death to occur naturally. Be sure to speak with your loved ones and family members about your wishes, and if you have more questions, speak to your JenCare physician to help you understand all your options. Thanks for listening. We believe that our patients here at JenCare, if faced with a terminal illness, should have the full right to choose how they pass. The right to choose in your final hours may be your last right to dignity. That's the JenCare difference.